Could you briefly introduce yourself and share how you became involved in advocacy for Bohring-Opitz syndrome?
Absolutely. Laura Bedmayev. I am the founder of our foundation, also known as the ASXL Rare Research Endowment Foundation. My son, Alex, was born with this ultra rare neurological syndrome. And when he was first born in a NICU, and we were swept into this whirlwind. Alice was like a full-term pregnancy. It was completely uneventful. There were no issues. We had no idea what was happening at that time, and sort of swept into the medical system where every month we were meeting with all different specialists because they knew just from looking at Alex that likely there was something genetic. He had like these lower set ears that were slightly rotated and a small mouth and long fingers and just combination of features that said this is likely something genetic. But every time they would run different tests, nothing was showing up on these screens, and no one had ever seen anything like this before. And so it became a process of elimination to try to get a diagnosis over several years. And finally, Alex was chosen as one of the pioneering samples for whole exome sequencing, which is one of the only ways that you can diagnose this. Now, many decades ago, that test cost probably as much as like a Beverly Hills mansion. And now the test, I think it's like under $1,000. There's major universities and hospitals who are screening all their NICU children now with this test. We're seeing exponential growth of people getting diagnosis very early in their life, which is amazing, which is really exciting for us. And so at that time, Alex was diagnosed with Bohring-Opitz. This is a random mutation that occurs on a gene called ASXL1. And, the correlation of this gene and that diagnosis in medical literature was only even discovered in 2011. So this is very new. There are many other rare disease groups, I would say, that are decades ahead of us in their journey, right? But I think they've laid a lot of the foundation that gives me hope for the future of accelerating pathways to treatments. Now, when we were continued on our journey, and I felt that every year, even now, brings all type of new surprises, right? We don't know what to expect. A lot of our experiences are not documented in medical literature, and that's really critical to the care of our children. And when Alex was first diagnosed, I went to social media because we were the only people even in New England, and I found another family and their daughter was undergoing chemotherapy. And so I was able to connect our geneticist and hers, and they published an article in the American Journal of Medical Genetics about the correlation of Alex's syndrome and Wilms tumor, which is a treatable cancer if you know about it. This girl unfortunately had to have her kidney replaced because it wasn't discovered until it had spread pretty rapidly. So that to me solidified the idea of the importance of research and how this can impact families' lives. And so from that point, we were able to get insurance coverage for screenings every few months. And then we also had other findings along the way. And so I felt that there was a strong need to focus on research and capturing the family's experiences, translating those into the medical literature so that the professional community can help improve the quality of life. And then families have the resources and information they need to advocate, as many of us are the only Bohring-Opitz patient that many of our doctors see. So that's really critical. It's sort of the essence of why we started this journey. I did choose to also include ASXL2 and ASXL3, and we're also learning now about so many different variants among all of these genes because there's a lot of synergies as it relates to the science, and you're trying to understand some of these scientific complexes like PRW, PRC1, PRC2, and how all of these things ultimately translate to what is the mechanism behind these disease? What causes this to happen is foundational to pathways to treatments. And we are getting closer, and our professional community is growing exponentially. And so I think that, there's a lot of power in having those three, that gene family together from a research perspective. So that was the essence of starting this journey.
And when do you advise parents to pursue genetic testing, and why is whole exome sequencing often the fastest route?
So I feel like, whole exome sequencing is one of the most comprehensive tests and can detect things at a much more like molecular level versus something like a traditional karyotype test, or, there's a lot of different panel screenings, but they can only go so far, whereas whole exome sequencing is much more thorough in terms of the testing. I think, one, I would definitely say there's development happens in ranges, right? Like if you think about when a child walks or when they talks, like it's not the same for every child. But if you're noticing that, your child from a developmental standpoint is on the edge or different, or if you notice, if you have multiple children or you're familiar with like younger children, you notice differences. Something doesn't feel right. It doesn't seem like they're developing in the same way. We've heard from many parents, because there is such a huge clinical spectrum, that sometimes they're questioned of, they feel in their gut something's not right. And, the doctors are telling them not to worry. I think always trust your gut, pursue it. There's not a downside, I think, to testing, to understanding what potentially is happening here. There's so much that we don't know. There's so many people in the world who are undiagnosed or misdiagnosed, and that's really important to have that information so that you can better manage the care of your child and, advocate for an improved quality of life.
And do your child Alex is diagnosed with ASXL2, right? Because they have
It's XL1.
one. Oh, sorry. One.
It's okay.
And so do the symptoms differ differently among children with ASXL1? And do they appear early or evolve over time?
I think many of them would, you know immediately something is not right. Like, so for example, with Alex, he had a lot of difficulty, drinking a bottle or sucking, right? He had a poor suck. He was, like failures with life. He was very small. You could tell immediately something wasn't there. There's definitely a big range of clinical symptoms, right? There are some kids who ultimately need trachs, who, a lot of kids can't like sit or walk or talk, but then there are kids who are ambulatory. They can walk. There's, I think, one boy who has some sentences or some words, right? And there's so many factors that go into that, right? But I would say it's definitely a big range. The ASXL3 are probably like relatively significantly more high functioning than ASXL1, but they also have cases of like severe medical challenges too, right? So, but some of them, there's a lot more of them that can walk. Maybe they have more behavioral issues, right? So there's a big range, I would say, within each of the syndromes, and then among them, right? And so, but that to me is like the nature of a lot of rare diseases, where the clinical presentation could be totally different from one child to the next, even though maybe there's some aspects of the underlying disease that could be similar, or it's happening on the same gene, right? And so it could be so unique to each child. And that's why, gathering a lot of like like a lot of data about the people and their experiences and what they're going through is so critical to be able to better manage the care.
Since Alex is nonverbal and has complex needs, how do you recognize when he's in severe pain?
Yes. So, we have worked with the palliative care team. There's a framework called INRS. And I don't remember exactly what it stands for, but the essence of it is like, so we have a scale from 1 to 10, and we write about, okay, what does each of those levels look like? How do you know when it's escalating, right? Like maybe early stages of pain, he might be hyperventilating. There are certain gestures he'll have, like he'll rub his hand by his ear, right? Versus on the extreme when he's in a lot of pain and he's like fighting himself and hitting his head and kicking things and screaming, right? Like there's nonverbal ways, whether it's gestures, vocalizations, etc., that you can see what that looks like. And then we put together the plan because you don't want to get to that point, right? Of, what are things that you can do to manage it? And like some of them are medication based on the higher level of pain, but there's a lot of other things that we try to do to comfort him early. And like some of it could be redirection, or some of it is, understanding how to help him communicate what his needs are. Now, he does also have an eye gaze Toby device. It's like a computer screen with these tiles, and when he looks at them, he can communicate. And when he's on the lower edge of the pain scale, like for example, sometimes he'll say, my feet hurt. And then we've been working with the behavioral specialist and the speech therapist to say, okay, we heard what you're saying. We're going to give you a break from your foot orthotics now and take them off because we think that potentially is a source of pain. And maybe we'll put some type of cream to relieve the pain of your feet, right? I think when the pain starts escalating, if you can imagine, it would be really difficult to focus, even for your eye, on a screen, on this tile. And so sometimes it's kind of all over the place and it's hard to know exactly what's happening. But, I am optimistic over time. Like there's at our research symposium recently, we had a woman named Dr. Christy Johnson who is working to help translate nonverbal vocalizations and gestures into communication for other people. So imagine you're in an inpatient hospital, or you have a family member, a friend, like someone that maybe doesn't know the communication of your child, and helping them between seeing what they're doing and their vocalizations, using a software to translate for that person what they're trying to communicate. So I think I'm optimistic too about the future of being able to elevate the voices of our children.
And also in the Dysphoric Diagnosis podcast, many of the medical issues Alex has experienced, such as bladder dysfunction, you mentioned, and complex orthopedic needs, are not documented in the medical literature for Bohring-Opitz syndrome. How do you navigate this ongoing uncertainty? Do you have a strategies for documenting and sharing his symptoms across hospitals, organizations, or research groups to help broaden clinical awareness and expand the medical literature on this rare condition?
Absolutely. It's challenging, right? Because, we're fortunate that we live in New England where we have some of the best hospitals in the world. And so they're at least operating in the level of complex space where they maybe don't have someone with Bohring-Opitz, but they do have some complex cases, let's say with, reduced bone density, or children who also have severe intellectual disability, which has an impact in terms of, you're doing the surgery on a child who doesn't know what's happening, and then the psychological impact can impact the nervous system, and then subsequently have serious physiological impacts. So I would say one is, understanding, I'm connected with other families through social media and understanding their experiences, right? So there was a child in the UK who, went for, my son recently had the spinal fusion surgery. So while we were planning for it, I was researching and meeting with families, and this one family, the child after surgery, had a very traumatic experience, was in the hospital for 3 months. The surgery caused all type of downstream impacts from both of the lungs collapsed. The child had to be intubated, went to cardiac arrest, need central line, PICC line, right? Had spinal fracture. His body was fighting the surgery. They had to repeat all type of infections, right? So there's a lot of complications. How do you prevent that? Or another family told me about how they did their hip surgery and the spinal surgery, and then no one had ever taken out the hip hardware, and then the hip plates cracked after the spinal surgery, and then they had to repeat the hip surgery, which is a major operation, right? So, when we were planning for our spinal surgery, we said, okay, let's get the hip hardware out first before we do this, right? So it's like at this point in time, I'm the one who's gathering information from other families, learning from their experiences, and teaching our doctors to say, okay, like, how can we plan for this? Like, let's, meet with each person in the medical team and see what can we do preventatively so that this could be a smooth experience from a surgery and inpatient perspective. We had over 20 appointments this year just related to planning for the surgery and lots of care coordination among the team. So, I think from a longer term perspective, though, we want to be able to build the expertise to start publishing some of these case studies to drive some of this work. It's challenging, though, I think, in the rare disease space, because a lot of, like, we have these really great surgeons, they're focused on some of the bigger diseases bigger types of disease like cerebral palsy, right? Whereas, it's hard to find the right people who can champion the work. And so I think as a foundation, that's something that we're looking to do. We now have a full-time chief scientific officer, and seeing like, how can we be the ones now pushing out some of the information to the professional community, whether that's, we need our own IRB or pursuing other channels, but also having a voice in addition to collaborating with the professional community, continuing our natural history studies over time, putting out papers so that people know and can learn, and they're not reliant on just gathering information from families.
How does your foundation or the ASXL community develop standards of care through registries, family networks, or conferences?
Yes. So that's a journey. It evolves over time, right? So we have been hosting research symposiums every year to continue to build the scientific community and grow that globally. We have family conferences every other year, and where people can also enroll in research studies. We're funding a natural history study and biobank so we can collect samples and basically set the table so that researchers are interested in studying our disease, right? And we host virtual forums every quarter to keep the professional community going. So there's ongoing infrastructure. And then I think in terms of building expertise, right? So we've started with this ASXL care directory where families can make recommendations of different providers that they see. So in the early stages, it's just gathering people who may be interested, who are seeing these patients, being able to direct people in our community to the same doctors so that, those physicians can see multiple people who have these syndromes and start to build that expertise. I think the long term with that is that by having that expertise, they eventually can help us as we think about care plans. As we do have centers like in UCLA, they have an ASXL clinic where they're seeing a lot of these patients, right? Most recently, I was in Boston, where we're also looking to leverage the Epichroma Clinic so that they can also see ASXL patients, and they see currently people who have all different types of chromatinopathy disorders, so in the same family of our ASXL, right? And so building that expertise, being able to ultimately create this care plans, and I think long term, it's like you said, building those centers of excellence so that people can go to these hub hospitals in different places and be able to work with people who know more about their syndromes, right? And that we can also provide a lot of the resources to families. So we've done at a high level, we've created these living with guides for families so they can understand like the major systems of the body and like the type of specialists and what you can expect. But I think is how do we get that to be a lot deeper and more comprehensive and continue to build that medical knowledge base over time?
What short or long-term outcomes does your foundation hope to achieve?
Yeah, I mean, I think long term, right? Everyone wants treatments, right? I think that's the long term goal, right? And that is, there's a very robust pathway and roadmap to get to that point. And I would say at this point, we're in the preclinical trial readiness phase, right? So getting all of the data and the information and being able to better understand the mechanisms of these disorders. So things happening on the basic science side as well as the clinical side and preparation. And so like we've mapped out all different types of things in our strategic plan of how we want to get there, right? And and what I've learned about in science is it's not straightforward, in the world like business where there's certain methodologies and it's like, there's so many different forks in the road in science. There's a lot of high risk involved in certain areas where you just don't know how things are going to go. And then depending how they go may lead you a different route, right? So I think there's a lot of unknown and uncertainty, but how do you try to take strategic steps along that way to be good stewards of the funds that you have in the most efficient way to get there? And I do have a lot of hope, I think in the rare disease space, there's so much happening to try to build scale, right? And to help people get to those paths. Like people are moving to pathways a lot faster than decades ago where it just took so much more time and so much more money. So, we have some optimism there. I think in the short term, though, we still have to bring the families along the journey and how do they see the value and the information and the work that we're providing, right? And so, we have a patient education and engagement coordinator who is also an ASXL2 mom and is a tremendous resource for our families, hosts different types of seminars, adds to our resource library. And so I think it's continuing to build those connections and the community and share our knowledge with each other, whether it's through webinars or conferences and panels and like one-on-one connections with families. We host all different types of forums. I think there's a lot to it and helping people to see the value in the research and to continue to come on this journey with us. And again, like share back the information with them as we're all learning together.
So currently there is no treatment for Bohring-Opitz syndrome, right?
No, there's not.
In the previous podcast, you mentioned drug repurposing research. What is drug repurposing and is it underway for ASXL1 related disorders?
Yeah, so I think this idea is right. So if there's already a drug that's proven in the market, right? And let's say it's FDA approved, but maybe it's used for a different intention or purpose, testing that on models, right? That you have to see, like, could that potentially work for your disorders, right? And so, it is something that we are looking at, right? But I think we also need to ensure that we have the quality and type of models that we need to make that effective, right? And then there's different type of models that are more effective for our disorders maybe versus others, right? So we had at one point looked at potentially doing a drug repurposing study on flies, where the flies only had ASX, and there's other limitations in that space of why we ultimately decided not to do that study. But I think it's a very powerful way that some rare disease organizations have been able to find effective treatments sooner.
Well, what educational or healthcare resources do you wish were more accessible for individuals with Bohring-Opitz syndrome?
I mean, I would, I think the biggest question we always have from families is what to expect, right? And I feel in a similar boat sometimes, even though I've been on this journey, is what's next, right? And so like the last 5 years, we've had all kinds of complex surgeries and all, unexpected, right? We didn't know that this was going to happen. So I would love to be able to see a roadmap, like by different like ages, or what are the different types of potential challenges that you could face, or what are different ways that you can try to help your child, right? So, I think in lieu of not having treatments, for example, like we have found doing different types of therapy, like physical therapy, occupational therapy, speech therapy, different intensive programs around that, or things like osteopathic manipulation or pelvic physical therapy. Like there's many other non-invasive things that you can do that can help your child significantly in their health and development, right? So I think having some sort of playbook of the range of, or even like one of the things that we're looking at is like what type of medicines are effective, right? For our children. And you have to be really thoughtful about that. Or even we've learned that sometimes starting at a fraction dose is more effective, because if you start, like I remember once we started one medication at the full dose and Alex stopped eating entirely, right? But like fraction dose seemed to work okay. And so just having all of that information so that families can better navigate to know, what's on the horizon next, right? As we, like my son's a teenager now, as we're transitioning to adulthood, what does that look like? And we've heard anecdotally certain things of, some of the children develop more depression, or some of them have psychiatric issues. And maybe that's partly related to the fact that they're not in the school system anymore, and they're a lot more isolated, and they're bigger, and it's harder to go places. Like there's so many factors in all of this, right? But again, none of that is published. So it's hard to know outside of just anecdotes or, talking with different physicians who potentially see some of these other patients.
What would you like people to know about Alex?
Oh, what I like them to know about Alex. Oh, so many things. I mean, I feel like, to me, the most beautiful thing about having a child like Alex is just the tremendous purpose that it gives you in life. And so I feel that for everyone, being connected with the people who have these more complex medical disorders can really create so much richness in your life. And I encourage you to learn about them, whether it's, I mean, you may not know someone locally who has an ASXL syndrome, but just to reach out to your community, be engaged. I think disabilities advocacy and research advocacy is so important now more than ever. And a lot of these people are unseen in our society. And so, creating that outreach and engagement and being a voice is so much needed. And I really appreciate the opportunity to talk with you, Lydia, about all of this and to shine a light on kids like Alex, because I feel like, they are changing the world and bring so much joy and, so much purpose.